Hi, my name is Gayle Cote. I'm a nursing student at Maryville University for Nursing 612 Advanced Health Assessment. This is Molly. She's volunteered to be my patient today to help me with my head-to-toe assessment. Before we began, she emptied her bladder. She was able to put on a patient gown. We collected a set of vital signs, including a blood pressure, which were all within normal limits, a height and a weight, and now we will begin our head-to-toe assessment. Hi Molly, my name is Gayle. I'm going to be the nurse practitioner assessing you today. So we're going to start at the top and work our way down. So first I'm going to be looking at Molly's face and head. Her eyes and ears are symmetrical on her face. There are no abrasions, no obvious trauma. I'm going to feel the head now and make sure that she appears normal cephalic. So I'm going to feel the head. She has nice thick hair and even distribution, no nodules, no tenderness to the touch, and I'll move on from here. Now I'm going to have you make a few funny faces at me. Can you clench your teeth, please? Puff out your cheeks. Stick out your tongue. Raise your eyebrows. Close your eyes real tight, and a big smile. Good. Now I'm going to have you close your eyes and we're going to test some sensation on your face. Let me know when you can feel it. Good. Next we are going to do, I'm going to assess your jawbone. Can you open your mouth, please? Good. And there are no clicks felt upon opening her temporomandibular joint. Next we're going to move on to eyes. First, we're going to check pupillary response. Pen light to the eyes. And her pupils are equal and round and reacted to light bilaterally. Her eyebrows are symmetrical. Her eyelashes are pointed out and curved upwards. There's no erythema or edema to the eyelids or around the eye. Her sclera and conjunctiva are within normal limits. I'm going to palpate the lacrimal apparatus from outside to inside. And on this side, good. Any tenderness or pain to your eyes and your touch. Okay, and we're going to do a few more visual tests to assess for her vision. So next we're going to do the cover-uncover test. So look straight at my nose. Good. Good. And then we're going to check the 6 cardinal fields of vision. So I'm going to hold your chin and follow my finger just with your eyes. Good. Good. Next we're going to move on to the ears. So upon inspection, her ears are equal, they're level. There's no obvious trauma, no drainage coming from the ears. To palpation, is there any tenderness when I touch? No, you pull it forward, there's good recoil. We're going to do a couple of hearing tests. I'm going to whisper 3 words into each of Molly's ears and have her repeat the words out loud to test for her hearing. Red, orange, yellow. Green, blue. Good. Now we're going to use the tuning fork, and we're going to do the Weber and the Rhine test to test for lateralization of hearing and also bone-to-air conduction. So first we're going to do the Weber test. I'm going to strike the tuning fork and place it on the center of her head and let me know if you hear equally on both sides. Yes. Good. And now we're going to do the Rhine test. I'm going to strike the tuning fork again and put it on the mastoid process, and we're going to Molly's going to tell me when she can no longer hear the sound. So that the bone to air conduction is a 2-to-1 ratio, and that is a normal finding. Now I'm going to take a look inside Molly's ears. And you would do that test also bilaterally. I'm going to pull the pin up and back for an adult. Look inside here. And there's no swelling or redness to the ear canal. There's X-ray with a good light reflex. All the bony processes are in place. Landmarks. Make sure for other ear. And this one also looks good. Pretty gray tympanic membrane with a good light reflex. Bony landmarks are in place. And next, we're going to be assessing the nose. So inspecting the nose, the structure is midline on her face. There's no obvious trauma. Her septum is midline. I'm going to have you tilt your head back. I'm going to take a peek inside your nose. And the membranes are intact. There's no crusted or bloody drainage. The turbinates are visible and within normal limits. And next I'm going to check your ability to make sure that your nostrils are not occluded. So I'm going to have you close off one nair, please, and sniff for me. And then do the other side. Perfect. Now we're going to move on to the mouth and oral cavity. So upon inspection, Molly's lips are symmetrical on her face. Have you open her mouth? Inside. The oral mucosa, buccal mucosa is intact with no lesions. Have you lift up your tongue for me? Good. There appear to be an appropriate amount of adult teeth. They're pearly white in color. Open your mouth. Say ah for me. So her gag reflex is intact. Her uvula is midline. When she says ah, it raises with her soft palate. Her tonsils and pillars in the back are within normal limits. And now we're going to move on to the neck structure. So her neck is smooth without any obvious deformity or nodules present. There's no sign of jugular venous distension. I'm going to palpate for the carotid artery bilaterally, so you do one at a time. So I'm going to palpate the right, good, and left, good. Now I'm going to walk behind the bed and palpate for the thyroid gland. Sorry. So Molly, I'm going to have you tilt your head down and to the left slightly and swallow. Good. So her thyroid was palpable. There are no nodules present. And we're also at this point going to palpate the lymph nodes. So we're going to start with the preauricular, front of the ear, post-auricular, occipital, tonsillar, submental under the chin, submandibular, superficial cervical, posterior cervical, deep cervical, and superior clavicular. And there were no nodes palpable, which is a normal finding. Next, I'm going to listen to the carotid arteries and also to the thyroid and make sure that there are no bruits. So using the bellows stethoscope, Molly, I'm going to have you hold your breath just for a second. Good, there are no bruits, but breathe normal. So next, Molly, I'm going to have you stick your arms out at me. We're going to look at the upper extremities. The skin is equal in tone, arms are equal length, they appear equally, the muscle distribution is equal on both arms. Her cap refill is less than 2 seconds. Her nails have no ridges and there is no clubbing. I'm going to palpate both your radial pulse, bilaterally, and radial pulse, bilaterally. And her skin is nice and warm and dry. So Molly, I'm going to have you at this point turn around and we're going to take a look at your back. inspecting Molly's back. She doesn't look like she's having any increased rate of breathing. Her back is symmetrical. We're going to percuss for the vertebral angle. Molly, please let me know if you feel any pain. Okay, good. So at this point, we're going to do the thoracic cavity and some respiratory assessments. So Molly, I'm going to have you assess for tactile premises. So I'm going to have Molly, you say 99 each time I touch your back, okay? 99, 99, 99, 99, 99, 99. Good. Now I'm going to percuss down the back, expecting to hear resonance over the lung fields and dullness over any solid organs. We're going to do that one more time. I'm going to demonstrate just on one side to check for diaphragmatic excursion. So Molly, I'm going to have you take a deep breath in, please, and hold it. Okay, I'm going to use my marker mark right here. So, dullness. Breathe normal. Have a couple of breaths. This time, Molly, take a deep breath in and blow it all out. Measure, and it's about 3 centimeters, which is a normal finding. So now we are going to, I'm also, while she's here, I'm going to percuss the sides because this is a little bit easier angle. Okay. Now while she's here, I'm going to auscultate across her lung fields and listen to her breath sounds. Okay. Good. I'm also going to auscultate here on the lateral aspect of the lungs. Good, and now I'm going to have you turn around. Lung sounds on her posterior side and her lateral aspects are all clear to auscultation. So now I'm going to listen to the front for the breath sounds and to the back. So inspecting the anterior chest, you can see that Molly's not having any increased rate of breathing. There are no retractions. There's no accessory muscle use. There are no pulsations or heaves that are visible. We're going to palpate the chest wall. Her skin is warm and dry to touch. We're going to palpate the mid-clavicular line on the left side, about 5th intercostal space for the point of maximum impulse. So for her heartbeat. We're also going to do the tactile premises again on the front. So Molly, again, if I have you say the words 99, 99, good, 99, good, 99, good, 99, 99, 99, good. And then we're also going to do percussion down the front surface of the thoracic cavity. Expecting again the same resonance over the lung fields and dullness over any solid organs. Good. Next, I'm going to auscultate for the heart sounds. So Molly has a normal race and rhythm with a normal S1, S2 with no murmurs or rubs heard upon auscultation. We're going to listen at the aortic. Pulmonic. Erb's point. The tricuspid. And the mitral. Next, we're going to move on to the abdomen, so I'm going to have Molly lay back. Go from there. So first on her belly, we're going to check the contour. So it appears to be flat. Her skin appears to have no lesions, no discoloration, even tone, even contour. You can shine your light across the surface to show anything. There doesn't appear to be any irregular pulsations or masses visible. So after inspecting the abdomen, you're going to auscultate, so you don't accidentally move anything around that doesn't move it. So I'm going to auscultate to the 4 quadrants. And her bowel sounds are audible and active in all 4 quadrants. If I had auscultated for 5 minutes or greater and not heard anything, that would be considered like absent bowel sounds, very hypoactive bowel sounds, and there might be some concern for some blockage. So next I'm going to auscultate the artery regions in the abdomen. We're going to start with the aortic, the renal arteries bilaterally, the iliac, and the femoral. Good. So after listening to the belly, we're going to begin to percuss and palpate the belly. So we're going to do percussion in all 4 quadrants, expecting there to be a sound of tympany over hollow organs. So we're going to check, I'm actually going to walk around to the other side of the bed to assess for the liver border edge. So you're going to go from an area of tympany to an area of dullness for the bottom edge of the liver, and then an area of resonance to an area of dullness for the top edge of the liver, and then we'll measure. Start in the middle. At about 7 centimeters, which is a normal finding. So we're going to do the same on the left side, percussing for dullness for the spleen. We are going to start in the thoracic cavity at an area of resonance, and it's the spleen is going to be located at the point of dullness. So next we're going to palpate the abdomen. I'm going to do light palpation of all 4 quadrants. Please let me know if anything is uncomfortable. Discomfort. And we'll do deep palpation. Anything hurt? So there was no masses felt, no splenomegaly, no hepatomegaly. I'm going to see if I can feel for the bottom edge of the liver and spleen borders, and also palpate for the kidneys and the aorta. So I'm going to walk around to this side of the bed again. Smiling, I'm going to have you take a deep breath in for me and blow it out. But so Molly is a very skinny patient, so you can feel the bottom edge of her border of her liver. I'm going to do the same for the spleen, so I'm going to take a deep breath in, out. And I don't feel for the spleen, so I'd expect there to be no enlargement, which is a normal finding that you don't really feel the spleen. So next I'm going to feel for the kidneys. We're going to do the right. Come over here and do left for me. And then with a small person, you can assess for the aorta by using your thumb and your fingers in the center. Good. So next we're going to move on to the legs and the lower extremities. So again, skin tone is even. No obvious trauma, warm and dry to touch. The hair is equal bilateral. The hair distribution is equal bilaterally. Refill is less than 3 down here on her toes. Also, we're going to assess some pulses. And so we'll do fetal pulses. The penis, posterior tib. Popliteal heel behind the knees. Good. I'm going to have you do some strength with your legs. So I'm going to have you maybe pull your knees up. And put them down. Pedals in the middle. Push down. Good. Pull up. Good. I'm going to have you sit up for me. Let's go skeletal. So as you can see, her muscles are very intact. She's rolled right up for me. So for musculoskeletal, we're going to check some reflexes first. So I am going to test the brachial. Good. Good. And we're going to do the color. Ooh, that's a good one. And then the Achilles tendon. Good. And now I'm going to have you stand up off the table. Feel down your back. Do you have any pain or tenderness down your neck or back when I push? No. And I'm going to have you just bend over, touch your toes. Okay. So she has a normal spinal curvature. It's midline. No irregularities. Her hips are aligned. Her shoulders are aligned. I'm going to have you stand back up. And this concludes our head to toe assessment. Thank you very much.